Hello and welcome. My name is Jimmy, and I'm the licensed and registered counselor in ArchKL Mental Health Ministry. So, today's topic I'm going to talk about family and wellness. So, what is family? I guess everybody knows what is family, and the wellness in the family actually determines the wellness of a person in the long run, right? So, let's begin. Now, everything revolves around the family, right? So, we all start this life with a family, right? Whether it is composed of blood relatives, we are born into that family, or it is adopted, we are adopted into the family, adopted guardians, or even a closely knitted neighborhood. Like, for example, some of us who lives in the long house. So in the long house, you have multiple families within it, right? So it's a closely knitted neighborhood where all families takes care of each other. All family, they have their own chores, they have their do's and don'ts, they have their value systems, they have their perception of viewing a certain point of views in the world outside, right? So our family actually affects who we are, our thought process, how we think, our values. Which one do we think that it is right and which is wrong, right? For certain families, for example, for certain families, we might think that tattoos are wrong. It resembles gangsters and all those. But certain families, tattoos is one of their customs, right? So we learn views of things, in the world, right? We have certain political views, we have views about education, we have views about wealth. We learn certain habits from a family, how we eat using hands, eat using fork and spoons, eat using chopsticks, right? We learn to love, we learn to interact with each other, and there are many more. So as a child growing up in a family, there are many things that we learn through the people around us, who are the closest to us, right? So while we can't directly choose which family we are born or adopted into, those lucky enough to be in a healthy relationship family. So when I mention healthy relationship family, means the parents love each other, the grandparents are supportive, family members are well connected. They don't ridicule each other, they don't envy each other, they don't fight so often. These are what I mentioned as a healthy relationship family, right? So they are likely to learn and maintain healthy relationship in life, right? Because they grow up in a healthy environment, they learn all these healthy values, and yeah, they are more likely, right? I did not say that it's 100%, but they are more likely to learn and maintain a healthy relationship in life, right? And whereas vice versa, if a person which is directly in a dysfunctional family, they might struggle to connect with others, right? They grow up, they might not have certain skills, because if the family fights all the time, they might not know how to love others. They might not know how to speak properly to others, because maybe all the family does is shout at each other, right? So they might think that shouting is normal, right? So these are some of the examples that I gave, right? So one thing for certain, it is not an unchangeable situation, right? The keyword is unchangeable, right? In everything in a human lifespan, right, we are learning in our journey. So nothing is unchangeable. Everything is changeable, right? Nearly all families actually, when I mention like those lucky enough to born in a healthy relationship family, but actually nearly all families have some form of dysfunction at one time or another, right? Maybe certain times maybe bad times where both parents lost their job, and then maybe during MCO, people stay at home and parents lost their job and they quarrel all the time, right? Maybe during this period of time is bad, right? Most of the times are good, all right? So there are situations in life where there are up and downs in life, right? So there are a lot of things, there are a lot of factors that affects a family's wellness. Like I mentioned just now, it could be differences of values, it could be differences of stature, societal stature. Maybe the parents, one of the parents, maybe the father's side comes from a rich family, the mother's side comes from a poor family, or vice versa, or the education level. Maybe the mother studies until university, where the father's is only SPM, and all those kind of things. And even with certain values, which is different, right? Certain families, they value education, certain family, they value money, where children are encouraged to work as young as possible. So differences of all these kind of things. But what I want to emphasize today is on communication, right? So I believe that in a family, most important thing is communication, right? Everything, even though we have certain differences, it can be communicated properly, right? If all family members have the required skills. Okay, so communication is, I believe, is the most important thing in a family wellness. So yeah, here I mentioned communication is the most important factor in family wellness. So there are different aspects of communication styles in a family which contributes to the wellness of the family, right? So there are different styles of communication, right? There are passive, there are aggressive, there are assertive, and there is passive aggressive. So there are multiple styles of communication. So let me go one by one the communication styles, and at the end of the slide you tell me which are your family communication styles. Okay, now passive communication. So what is passive communication? It focuses on other people's wants and needs at your own expense. That means other people's needs and wants are more important than what I want and what I need. So what this individual will do if they have the passive communication style is that they are usually very soft spoken, right? They are usually very quiet, and they allow other people to take advantage of them, right? Because they prioritize the needs of others, right? Everything is about other people, my needs, never mind, right? My needs is secondary, right? So these people, they have poor eye contact because they have lack of confidence. Okay, so I give you an example of a passive communication style, right? I give you a scenario when, okay, let's say when this another family members, let's say for example an uncle comes to you, asks you to do something, but it is very inconvenient for you. That thing, you have to go out all the way and you are busy and then you have other things to do, but suddenly this uncle, just because you will never say no, right? Most of the time you will never say no. So your response will be yeah, okay, even though you are like very reluctant, you don't feel like doing it, but you will still say okay, you will still say that it's fine. So, and then on top of that, you will say that do you need me to do other things as well, right? So this is passive communication, right? So passive communication style of individual, they will put more importance to other people's needs than their own needs. So what happens is this. So for this person, this individual who has a passive communication style, when you focus on too much on other people's needs and because even though it is so uncomfortable for you, you will still do it. So what happens is that in the long run, I'm not saying that it's only happened once or twice, but in the long run, maybe 5 years down the road, maybe 10 years, right? If you keep neglecting yourself, then what will you do? What will happen to you? You will feel very, very sad inside. You'll feel very, very neglected inside. You feel very, very unfulfilled inside. And it accumulates. It eats you up inside, right? Because all you do is for other people. You don't do things for yourself, right? So these are passive communication style individual, right? Next, aggressive communication. Okay, this is opposite from passive, right? So aggressive communication style individual focus on my wants, my needs at others' expense. That means I don't care about what other people think. I don't care about whether other people like or don't like, but I just care about what I want and what I need, right? So an individual who has this aggressive style in the family usually speaks in a loud and overbearing way, right? They will talk loudly, right? They are unwilling to compromise. No matter what you say, no matter what reason you give, they will still twist your words and they will still want you to do it because they want you to do it, right? They like to use criticism. They like to humiliate people. They like to use words like stupid or you are lousy or you are lazy or you are not cooperative. They like to label people. They like to humiliate people. They like to dominate the person, control, right? And they frequently interrupt. When you're explaining, before you finish explaining, they interrupt because they don't bother to listen, right? Yeah, they does not listen and they are disrespectful to others, right? So the same scenario, right? So if let's say an uncle asks this kind of person to do things, guess what will happen? No way, right? So this person will definitely, if this, I will only do the things that I like, right? If you ask me to do something which I don't like, of course I won't agree. I will say, no way, you are crazy, right? Remember, labeling, domination and humiliation, use criticism, right? You use the word crazy, you're crazy to ask something like this from me. Impossible, I will do it, right? These are people with aggressive communication. Okay, so let's move to another form of communication style. This is passive aggressive. Okay, well, you have the word passive here and then you have the word aggressive and it's all mixed together. So what does that mean, right? So a person with passive aggressive communication style focuses on own needs. Okay, you focus on your own need, okay, like the aggressive people, okay, but you would not be so aggressive. That means you will not be so outspoken. You focus on your need. You don't really care about what other people's need, but you won't openly criticize them. You won't say it in a very loud voice, right? But you still fulfill their need, but in a very, very resentful manner, right? Imagine this. Let's say if you have okay, I'm not trying to label, but I'll just give an example. This is just an example. If you have a teenage kid, right? If you ask a teenage kid to do something, right, to clean their room or something like that, they will still do it, but they will do it in a very resentful manner. They will like, hey, okay lah, I do it. Those kind, right? So an individual who has this is called the passive aggressive style tends to do, but I'm not saying it's all teenagers are like that, okay, I'm just giving an example, right? Okay, so an individual who has this passive aggressive style tends to do what others want them to do, but will do it in a resentful way because their own needs are not fulfilled, right? So a passive aggressive person is like this, right? I want something, you ask them to do something that I don't like, but I will still do it. because I know because maybe you are the authority, or maybe I have to do it, I'll still do it, but my needs are still not fulfilled, right? You are still not listening to me, right? I will still do it what you want. So passive aggressive people, it will eventually, what will happen to them is that they will still do things in a resentful manner. And so as a family member, you have to be very very aware of this. You have to detect the signs of passive aggressiveness, because if not, it is also the same thing as a passive person, because their needs are not fulfilled, right? They are just doing what you want, and the resentfulness will get even stronger, and their needs are still not fulfilled, and one day they will explode as well, right? It's different from aggressive, right? Aggressive is always, I don't care what other people want, I just do what I want. So eventually in the long run, everybody don't like this person, right? Aggressive people, everybody also don't like this kind of person, right? So the same example, right? When a family member asks you to do something which is very inconvenient for you, a passive aggressive person will say, fine, I'll do it for you. But deep down inside, you still not understand what I really want, right? Okay, let's move on. Now, we come to a fourth style of communication, which is assertive communication, right? So assertive communication focuses on the needs of others as well as the needs of self, right? This one is balance, right? You focus on your own need and you focus on other need. So you might ask, how is it done, right? This is the best style of communication in a family. So an individual who is assertive usually stands up for their own need, but is willing to listen. The keyword, willing to listen to others in a respectful way. This is the key phrase. Willing to listen to others in a respectful way, right? And usually communicates with confidence and willingness to compromise. You are willing to listen, give and take. You are willing to talk it out, not shout it out. Okay, so the same example, when other family members ask you to do something which is very inconvenient for you, your response as an assertive kind of communication style should be, well, I actually have something else to do, right? I'm very busy, but I can help you for a while if you're really in need of help, right? Do you really need to do this? And if this is very very important to you, I can help you to do some, but I'm actually very busy as well, right? So maybe I can help you half a day, or I can help you for a few hours, that kind of thing, right? You negotiate, right? You don't put your needs, you don't push your needs to others. You also don't accept it at your own neglect of your own, at your own expense, and you don't do it resentfully. You communicate it out. This way, actually, it fulfills both your needs, and you negotiate with the other person who is trying to ask you to do things. So you try to strike out a balance, right? So this is a style which I recommend to all family members to learn, right? So all family members should learn this style, because a lot of problems in family all starts from communication, right? And not everybody knows how to communicate well. Like I mentioned, when you come from a different family, they have different styles, they have different values, they have different environment, the way they communicate is different, right? But I believe that everybody has to learn this assertive communication style, because it is very very good, very useful, and it will solve a lot of problems in the family. Okay, so these are some of the communication practice if you want to practice, right? So if you want a healthy family environment, good communication is a must, right? And the question is, are you willing to practice, right? This is the only question. Are you willing to learn something new, right? So if you are willing to learn, so here are some scenarios which you can actually think on your free time. What is your usual response? Then you can know what type of communication styles you belong to, and then you can start practicing on assertive styles. Remember the keyword of assertive styles, right? Willing to listen, willing to compromise. Okay, so here are 3 scenarios. First scenario is at work, right? Your boss asks you to stay late at night in the office where everyone else has left. It is quite often your boss asks you to stay and you have plans tonight. So what are you going to tell your boss? Practice it using assertive style, right? The second scenario is in a house with your spouse. You saw your spouse make a mess in the kitchen, and most of the time he or she makes a mess in the kitchen, and you have to clean it up most of the time. So how should you communicate with your spouse? Not shout, right? Not blame, right? So use your assertive communication style, right? And then the third scenario is with your friend. So your friend showed up at your house suddenly, hey, how are you? But you are actually busy with something. So how do you turn your friend away? By using assertive communication, right? So practice it, right? Imagine it in your head, those scenarios, what you usually say, what you usually do, what type of communication styles you used to belong to, and how can you use assertive communication to say it in these situations. Okay, so practice makes perfect. Okay, so if you really need extra help, you can seek family therapy with us in AMHM, Archdiocesan Mental Health Ministry. We do provide counseling services, right? You can go to seekcounsel.archkl.org to fill up a form and then schedule an appointment with a counselor if you need help. All right, thank you very much for your time. That's all.